The John Locke Foundation has released a new report with the title Certificate of Need in North Carolina, Cost, Access, Treatment. Joining us to talk a little bit about it is Brian Balfour. He is Senior Vice President of Research for Locke. And Brian, this is interesting what this paper found. First of all, for people who don't know, remind us, what is a Certificate of Need?
Yeah, Mitch. Well, basically, a certificate of need is a process that hospitals and other medical care facilities need to go through, and essentially requires them to get support from a state government commission, support and approval to expand their facilities, open up more hospital beds, or buy certain types of medical treatment equipment, things of that nature. So as you might suspect, that can serve to disincentivize expanding access to care, expanding those facilities. And oftentimes these commissions are stacked with entrenched interests of big hospitals already. So imagine, say, a Burger King wanting to open up new locations, and there's the CEO of McDonald's sitting on the commission giving them a thumbs up or thumbs down on permission to open up the facility. So what the study really kind of wanted to dive into is, just what sort of an impact these certificate of need laws have on healthcare access.
Shorthand, sometimes we've called it a government permission slip for these healthcare providers to operate. You alluded to this, but your report, which is written by author and researcher James Bailey of Providence College, looks a lot at what the academic research has said about certificate of need. What are some of the things he found?
Yeah, and Dr. Bailey did a great survey of the academic literature over the past several years, and he's done some original research himself on the topic. But some of the highlights from his findings include, for example, certificate of need laws are associated with 13% fewer hospital beds in states, also 30% fewer hospitals per capita in states, and one kind of specific with regards to, say, substance abuse, con are associated with 42% fewer substance abuse facilities in states that have those laws. And as you might suspect, basic economics is telling us when supply is limited, that's going to help drive up the costs, the price of things. And so what the report also found is that healthcare prices are roughly about 14% higher on average in those states with certificate of need laws. So restricted access, higher prices is some of the results that we found in this study.
He also, beyond looking at what the academic research has said, takes a look at how reducing or repealing certificate of need would affect a couple of different important areas. One of them was mental health. How might changes that reduce certificate of need burdens affect mental health treatment?
Yeah, and we put some emphasis on mental health facilities as well as substance abuse facilities, and really in the shadow of the COVID lockdowns, seeing a spike in those problems here in North Carolina and across the nation. So what the findings, what Dr. Bailey found, for example, here in North Carolina, if we were to eliminate the con laws, we could see the number of psychiatric hospital beds increase from 15 to 18 in North Carolina. So what that means is being able to just accommodate more people and provide treatment for those people in need.
And that was the number of hospitals, right, from 15 to 18?
That's correct.
And also, in addition to that, you looked at, as you mentioned, substance abuse, and there was an impact on the number of treatment facilities and the potential for treatment facilities for people of lower means?
Right, exactly right. What his research found was not necessarily an impact on the number of facilities overall, but because of the more competitive nature of lifting the con laws, he found that more substance abuse facilities would accept both private insurance and Medicaid, which of course means people of lower income status that just don't have the financial means otherwise to afford these treatment facilities. It would now become attainable for them because of that expanded access with the private insurance and Medicaid. So again, just eliminating con laws just creates a greater supply of the kind of healthcare needs, medical facilities that people are most in need of.
And all of this fits in with this generalized notion that certificate of need is something that if you can't repeal it, at least you ought to reduce it, but you ought to be working toward repealing it.
Yeah, right. And part of the report also emphasizes that North Carolina is the third strictest state in the country when it comes to con laws. So absolutely, I mean, short of full repeal, which is what we'd love to see, certainly steps in those directions just to get us away from being among the three most restrictive states in the country. We can at least start to take some significant steps in the direction to provide more access for North Carolinians.
Once again, the report is titled Certificate of Need in North Carolina, Cost, Access, Treatment. You can find the report at johnlocke.org. Brian Balfour is Senior Vice President of Research at the John Locke Foundation. Brian, thanks for joining us.
Thank you.